Joining us today. We are here to announce a new public health commission. It's going to be it's a 23-member public health commission on preventing violence and promoting community mental health. And many of the members are with me today, and in your packets we'll be handing out the members of the commission. We held our inaugural meeting earlier today. This commission is going to be co-chaired by Reverend Erlene Coleman of the Bethlehem Baptist Church in McKeesport and Dr. Ron Voorhees, the acting director of the Allegheny County Health Department. We've got many organizations working to address violence in our community. One of the leaders on this has been U.S. Attorney David Hickton and his Regional Anti-Gang Conference and Youth Futures Commission. Generally called the Youth Futures Commission, short to that. The Pittsburgh Foundation and many other organizations who are represented on this commission. We're approaching this from a public health perspective and are seeking to find solutions that can be done countywide and adopted at the community level. And I would like to first of all recognize Representative Ed Gainey. Ed, newly elected representative to the state legislature, came to us a number of months ago because of some of the issues that are occurring in his community around violence and community mental health issues. And I was going to have Representative Gainey come up and say a few words regarding the formation of this commission. Representative.
Good morning. First and foremost, let me thank Rich Fitzgerald for having us today. We know that the violence in the community and mental health needs to be addressed. We see it happen on the national level and on every other level, the state and locally. And it's time that we become more proactive and try to find solutions or try to find best practices to help us be able to eliminate some of the violence and other things that's happening in these neighborhoods. And one way of doing this is to make sure that we're studying best practices. So the group here today is eager, we're focused, and we really want to make sure that we're bringing back ideas and programs and solutions that work. So we're going to be focused on making sure that we look at the best practice, the best ideas, implemented in our communities, and doing all that we have to do to make sure that we reduce and eliminate the violence in our neighborhood. And I want to again thank Rich Fitzgerald, the co-chairs of the commission that we're about to put together, and also want to thank you, the media, because it's going to take everybody. We need to start highlighting things that work in the community and working together to make sure that the messages that we're putting out is messages about life and making sure we're doing what's necessary to make this the greatest region that we can. Thank you.
And let me also bring up the co-chairs and have them address as well. And Representative Gainey said it very well. You know, we want to make sure we're addressing this as a public health issue, dealing with community mental health to prevent violence in all forms. And with that, I'd like to bring up and recognize Reverend Erlene Coleman, one of the co-chairs of the commission. Reverend.
I too want to thank Mr. Fitzgerald, and I also want to thank Mr. Gainey for this process that we've come to. I'm so glad to be able to work on this broader sense of trying to accomplish or going to accomplish what we have each been trying to do in our separate communities. But this is a wonderful opportunity for us to come together around the table and to work it out together, put our ideas together, and really put our feet to the floor and to the ground, our nose to the ground, and realize that as a group, as a united front, that we can make a difference with this violence and promoting community mental health. Amen?
Thank you, Reverend. And the other co-chair is our acting director of the health department, is Dr. Ron Voorhees. Dr. Voorhees.
Several months ago, I was privileged to speak with Representative Gainey and Austin Davis from Rich Fitzgerald's staff to talk about what do we do about violence. And from the very outset, we considered this to be a public health issue. So we're not just talking about reducing homicides. We're talking about what are the things we can do that change the fabric of communities in Allegheny County so that violence doesn't occur. And so that people feel safe and secure in their communities and can really have healthier and happier and more productive lives living here in Allegheny County. We think there are a lot of things that we can do and a lot of things we must do. Homicides themselves are up 25% over the last decade. We're seeing certain communities that are being hit very hard, and we really need to take a look at the things that we can do, things that other places have already done that we need to try here, and to do as much as we can to not only reduce violence, but really about promoting positive health in the communities of Allegheny County. So we're really pleased that we have a wide variety of people bringing different perspectives and a lot of experience to the table, and we think we can really make a difference.
Thank you, Dr. Voorhees. And then the last person I'm going to bring up, and then we'll open it up to questions from the Department of Human Services, because obviously the county's Department of Human Services will have a big impact on this, is Pat Valentine. I was going to ask Pat to say a few words.
Thank you. Violence among people with mental illness, like violence among people who don't experience symptoms of mental illness, is extremely rare. However, we want to prevent violence of any type regardless of who is involved. We also want to assist people to detect mental illness and emotional disturbances at as an early stage as possible, and assure that services are available to address those problems appropriately. Nationally and in Pennsylvania, about 20% of adults have a symptom of any type of mental illness in any given year, and over 4% of adults have serious and persistent mental illness. And although we in Allegheny County have about $90 million spent on mental health services per year, this funding is primarily intended for services for people with serious and persistent mental illness, as opposed to assessment and prevention and the more community mental health services for the general population. And it is important that we find ways to make people aware of danger signs in themselves and in others and in the communities, and provide them with the appropriate resources to address concerns at an early stage. Thank you so much.
And as you can see, looking at the list of the 23-member commission, it's a very wide-ranging and broad-based folks from the community-based organizations, from the foundation community, from our universities, from health organizations, elected representatives, a judge from the Court of Common Pleas. So we've got a broad base of folks to give us a lot of input, many of which have done a lot of work in this area for many, many years. So we'll be able to build upon some of that work that was done. So with that, we'll open up to any questions.